The pocket laser is a class 4 diode laser with a 915 nanometer wavelength, able to work either in continuous or pulsed mode. It is devised for many clinical applications thanks to its power, which arrives at 6 watt at the fiber. Its very reduced size, it weighs just 750 grams, makes the device easily transportable and usable in small places and even without electricity. It can be operable for 30 minutes at its max 6 watt power with the battery fully charged. This autonomy may vary depending on how the device is used, and it does increase by decreasing the set power. It is provided with a rechargeable battery and its battery charger, similar to the one used by a smartphone. The time needed for the battery to fully charge depends on the mode of the recharge selected. 8 hours if the laser is switched off, slow charge. 4 hours if the laser is switched on, fast charge. The recharge is completed when the green LED switches off. Available fibers have diameters from 200 to 400 microns. 2 handpieces are also provided, one for contact interventions and the other optional, defocused, for contactless interventions. Plastic tips for contact handpieces are single-use and can be easily plugged on each interchangeable end of the handpiece. The laser is provided with 2 pairs of protective eyeglasses, a pair for the practitioner and a pair for the patient. The laser is charged and ready to work. The clad-made fiber is covered by an isolating sheath whose terminal side must be removed to allow the laser ray to reach the tissues. The fiber gets bared by means of the fiber stripper provided. The selection of the size of the optic fiber to use depends on the clinical application. The contact handpiece is set up to make inserting the fiber easy, allowing use of its full length up to the tip. The fiber is blocked by rotating the rear end of the handpiece. The plastic tip is screwed into the end of the handpiece. Having put both parts together, it is necessary to check the status of the working part of the fiber. Once the fiber and the handpiece are ready, the opposite end of the fiber must be plugged into the laser device so as to be connected to the diode. To switch the pocket laser on, press and hold the switch on key for a few seconds. The laser will buzz and a message will appear on the display to tell the operator what to do next. The laser will not work if the foot switch is not connected. It is enough to firmly push the foot switch and release it to have the connection established. Please pay attention. When connecting the foot switch, push it only when requested. The initial screen shows 2 menus, and the display functions also as a touch screen. The Options menu allows the selection of the language, the setting of the time the display remains on, management of the access pin, and to see the messages related to the serial number of the laser and the firmware revision number. All this data is preset, but they can be modified if needed. The laser has 4 applications: periodontium, endodontics, surgery, and others. Inside each of these, it is possible to permanently store personal standard settings for different applications. To use the laser with different setups, go to the manual settings in the lower right-hand side of the screen. The arrow on the lower side of the screen shows the way back to the main menu. For example, by entering the file endo, it is possible to set up the laser and save the parameters for each endodontic treatment. It is possible to plan to sterilize root canals by setting 2 watts of power, medium frequency, and a pulse duration of 50% in order to get an actual laser emission of 1 watt for 20 seconds. For specific needs, the alternative can be to use the same power but to adopt the super pulsed mode. It is possible to set up parameters for different applications in order to use this medical device at any time during the daily clinic activity. Other applications can be accomplished right away as well, such as tooth whitening or dentine desensitization. Once the desired setting is selected from the menu, just press the Start key to begin the intervention. Once the intervention is completed, the laser can be stopped by pressing the Stop key. Manual mode is used to create customized settings. By pressing the plus and minus keys, it is possible to modify set values, selecting first the variable that needs to be changed. To work in continuous emission mode, simply select the mode at the top right side of the screen and modify the parameters as required. To save the settings, select the disk icon. At this point, a keyboard pops up to enable the naming of the settings to be stored. To enter the Applications menu, select again the disk key. Now, select where to memorize the new settings and in which one of the 4 applications and in which memory cell of the chosen application. Press the disk key to complete data storage. Once the treatment is completed, the laser needs to be put away with care. All parts that come into contact with either the operator's contaminated hands and the patient must be carefully disinfected. To switch the laser off, simply press the same key used to turn the laser on for a few seconds. The device will buzz and switch off. Once the fiber is removed, it is necessary that the connectors, both to the fiber and to the laser, are protected by their own caps. It is possible to protect the display and the handpiece by covering them with a transparent film, better if self-adhesive, to be removed after having completed each intervention. The removal of this protective material does not hinder the possibility to further disinfect the device with chemicals. A non-corrosive disinfectant should be used to remove contamination from the display from the operator's hands. The plastic tip must be removed and discarded at the end of each treatment. At the end of the day, the fiber is unscrewed from the handpiece and disinfected. All dark residues must be removed from the contacting end. The handpiece can be placed in the autoclave after its disassembly, disinfection and enveloping. The laser-aided whitening of vital teeth needs the defocused handpiece and a chemical material that is activated by light, thanks to the chromophore it contains. Before starting, it is necessary to prepare the tooth surface by gentle polishing and to take the actual color shade by means of the Vita's color standard. It is necessary that both operator and patient wear protective eyeglasses. Pictures of the starting color, referred to the Vita's color standard, are routinely taken. The patient is then prepared by the placing of the photopolymerizable dam and the layering of 1 to 2 millimeters of whitening gel over the tooth's exposed surface. In this case, a blue-coloured 25% hydrogen peroxide-based gel has been chosen and is layered on the surfaces of the teeth. The power selected is 3 watts with a 1 kHz frequency with quite a high pulse duration. The defocused handpiece is kept 2 centimeters away from the tooth. The surface of the tooth is irradiated by using a circular motion for up to 5 to 8 seconds before passing to the next tooth. A graphic showing the power peak during the activation of the laser will appear on the display. After having passed once over each tooth surface, the whitening gel is removed to allow the application of a new layer of whitening gel, getting re-irradiated in order to accelerate the whitening process. To achieve the desired result, the treatment can be repeated 2 or 3 times. The laser-aided gingivoplasty can be useful even between interventions during a non-surgery periodontal treatment, for instance, to remedy slight gingival expansions which may impede the correct cleansing of areas at risk, such as furcations. It is possible to choose from 2 preset functions: gingivoplasty at a 2 watt power and medium-low frequency, or gingivectomy set at 1 watt in continuous mode. The choice between the 2 functions should be based on the type of tissue to be modelled and the treatment objective. Choosing the gingivoplasty function. The laser is activated by using a piece of blue-coloured articulation paper. The contacting end must not be pressed on the tissue, but should be used like a brush that sweeps away the tissue to be removed. There will be no bleeding or pain from the patients who do not receive any form of local anaesthesia. Another example of laser use for the gingival modelling is the case of the localized papillary hypertrophy. This type of intervention allows aestheticians to cut only superficial epithelial and connective layers without modifying anatomic structures. No local anaesthesia is required and no bleeding is present in the affected area. The case shows a distal vestibular 4 mm probing. Here too, the conventional use of manual tools specific for implants is aided by the laser. continuous mode with a low 1 watt power is chosen. The diode does not cause the metal to overheat. The fiber's end is directed to the implant surface and is used with vertical and horizontal movements. The laser is a great tool for aiding conventional instruments in non-surgical periodontal treatments. In this case, the probe shows a severe impairment of the mesial-palatal structure and probing larger than 5 mm. The non-surgical periodontal treatment is made with manual and ultrasonic tools to get the maximum removal of all hard and soft deposits and the detoxification of the area. The curettage function is used to allow the laser to remove both the infected and the granulation tissue from the soft walls of the pocket. In this instance, continuous mode has been chosen. The fiber is uncovered and prepared for the treatment. The laser is activated when the fiber is slipped in the pocket. The movements are side to side and up and down, with the fiber's contacting end directed towards the gum. In very deep pockets, when the complete removal of the calcified deposits becomes more difficult, the laser guarantees an optimal disinfection of the hard and soft surfaces and the removal of granulation tissue. Once irradiated, the granulation tissue is easily removed. The endodontic laser-aided therapy follows the classic procedure of shaping and cleaning of canals with mechanical tools and irrigating disinfectants and detergents up to the apex. Alcohol-based irrigators must not be used. The laser treatment comes before the closing stage. It is necessary to wear the protective eyeglasses supplied with the device. The laser removes the smear layer of the microfrustules of the canal's pulp and decontaminates and closes dentinal tubules. The use of the 200 micron fiber is recommended. Once the canal is dried up with paper cones, conditioning with the laser can be undertaken. 20 seconds are enough to treat a canal using 1 to 1.25 watts of power. The fiber is gently inserted right to the root apex. Once inside, the laser is activated and moved using continuous circular motions from the apex up to more coronal surface. The diode's wavelength is not absorbed deeply by the hard tissue. The high frequency minimizes chances of overheating. Once the canals have been treated, the process can be repeated a second time. Having completed the laser treatment, the canal is dried and closed temporarily in the conventional way. With the laser-aided decontamination, the patient does not need analgesics. The laser irradiation minimizes post-treatment pain and swollenness. It can occur that during a conservative task, the caries damage forces the removal of dentine very close to the pulp chamber. At times, the layer of good tissue is too thin. At other times, it is necessary to create a slight break. The clinical case shows an indirect pulp capping with disinfection and conditioning of the hole's floor. The laser is applied after preparing the hole before its closing. For the indirect pulp capping, up to 2.5 watts of power can be employed with quite a high frequency. It is suggested a 70% duty cycle for 10 seconds. For the direct pulp capping, the power must be lower, 1 to 1.5 watts, always at high frequency and with a 50% pulse duration. An irradiation time of 10 seconds is recommended. A fiber optic recommended is 200 or 300 microns. When practicing an indirect pulp capping, it is used in contact with the dentine that needs to be contaminated, which is in the upper side of the pulp's chamber. In the case of a direct pulp capping, the fiber is kept at a distance of 2 to 3 millimeters. After 10 seconds, use a jet of air to cool the area down, or rinse with a sterile saline solution when the pulp is exposed. The treatment can be repeated 2 to 3 times. The hole is then closed in the usual way. Dental sensitivity is a problem often present, especially among those patients who have undergone periodontal treatments or suffer gingival recessions. The diode's working action seems to intervene on the C fiber's inhibition inside the dentinal tubules, along with a possible effect of lumen stricture. Before the laser intervention, gentle polishing is necessary to remove any possible presence of material alba or bacterial plaque. To reduce tooth sensitivity, the literature suggests 1 to 1.5 watts low power. A 70% duty at high frequency for 20 to 30 seconds would be advised in this case. The fiber diameter is 300 to 400 microns. It is necessary to isolate the area to be treated with cotton rolls before irradiating. It is also possible to use fluorine-based gel on the affected area. The fiber works upon contact. When sensibility is higher, it is possible to make the first applications without making contact, by keeping the fiber at a distance of 1 millimeter. Alternatively, lower settings can be selected, thus reducing the percentage of duty or the power. It is advisable to make 3 applications at 30-second intervals to allow the treated area to cool. The treatment should be repeated 3 to 4 times at weekly intervals. For surgical applications, the use of the laser still requires a light local anesthesia. The clinical case presents a hyperkeratosis on the masticator mucosa localized in the edentulous area between 3.5 and 3.7. From the laser menu, select surgery and a continuous cutting mode at 4 watts power. Once the laser is activated by the black paper, the intervention starts. The cut is clean and precise. Without applying any pressure, the laser cuts and clots at the same time. When using the laser, it is important to cut a little bit more than when using a scalpel. In effect, it is necessary to consider that the tissue close to the cut edge is altered by the heat, and biopsy cannot be made on such damaged cells. It is also important to respect the periodontal structures close to the tooth that are not involved in the biopsy. The edge of the free gum must be kept intact. The surgically intervened area is free of bleeding, so there is no need for sutures. The patient's after-surgery discomfort is minimal. The clinical case presented here shows a periodontal-wise damaged area localized in the 31 to 41 site, in which the coronal insertion of the vestibular frenulum causes a constant traction, which further complicates the already compromised periodontal condition. The laser is set by selecting a continuous 3 watt cutting mode, having considered the characteristics of a quite vascularized, non-keratinized tissue. The fiber's tip is activated on black paper. A mild local anesthesia might be necessary. The bleeding is controlled by the laser's clotting effect, which allows a clear view when working. The small vessels that are still open are located and closed. There is no need for sutures in this case either. In this second case, we see the incision for orthodontic purposes of the tectorial labial frenulum. Local anesthesia is provided for the patient. A continuous mode 5 watt cutting function is selected, taking into account the consistency of the tissue. That in this case is quite fibrous, with a large keratinized epithelial thickness. The intervention proceeds by cutting the frenulum from its palatal insertion up to clear the whole vestibular mucosa. No bleeding. It looks like the section to be eliminated is wiped out little by little. No sutures are then needed. Implants exposure is a very useful laser-aided application. A mild anesthesia is provided for the patient. The tissue's nature imposes the use of quite high power, 4 watts in continuous mode. The laser is activated. The cut is clean and to the required depth, although cutting in the same place is still required. Once the fixture's head is uncovered, the abutment is removed and the healing screw is placed. This is a non-strictly dentistry application. It goes towards petty dermatology. It is a common nevus that has an inflamed area at its base. This nevus must be removed to prevent possible histological alterations. The area is carefully disinfected by a gauze soaked with iodized solution. A mild local anesthesia is provided to the patient. The laser's fiber is activated over a black paper. From the surgery menu, the continuous mode cutting is selected with a 5 watts power. The cut is precise. There is no bleeding. The nevus is removed quickly with no sutures needed nor subsequent dressings. The post-intervention site is perfectly clean and bloodless.